presented by Paiva Luciano, please.
Good afternoon. My study is about the influence of surgical trauma on the behavior of serum albumin after spine surgery. The albumin is the most important plasmatic protein, and its main function is to maintain the colloidal osmotic pressure and pH. It's considered a negative acute phase protein. In other words, the production of the albumin decreases in response to any inflammatory stimuli, so the traumatic injury and surgical procedures cause tissue edema and low plasma protein concentration. The objective of this study is to evaluate the variation of concentration of albumin in spine surgery and relate it to clinical outcomes after surgery. It's a clinical perspective and observational study in which we analyzed 55 spine surgeries performed at the Hospital of Federal University of São Paulo in 2009. The blood samples were collected the day before surgery and 24 hours after the procedure. The post-operative complications, both clinical and the wound conditions, had a follow-up of 30 days after surgery. The mean reduction in serum concentration of albumin was 0.58 ddl, and the maximum reduction was 1.8 ddl. In 12.7% of patients, the decrease in serum albumin was greater than or equal to 1 ddl. 78.2% of patients had a serum hypoalbuminemia in the post-operative period. Before the surgery, just 38.2% of patients had a serum albumin smaller than 3.5 ddl. We had two complications, a pneumonia after correction of Sherman disease and a superficial infection after cervical fusion. Rhodes and Alexander in 1955 were the first ones to describe that the reduction in serum albumin is a risk factor to morbidity and mortality in the post-operative period. They explained that hypoalbuminemia after surgery occurred due to the changes in vascular permeability and due to the decrease in hepatic synthesis after metabolic stress. The hypoalbuminemia mentioned in other surgical specialties also occurred after spine surgery in this paper in 78.2% of patients. Gibbs observed that the variation greater than 1 ddl increased twice the chance of death. In this paper, 12.7% of patients had this variation, and after the deformity correction, all patients had a variation of serum albumin greater than 1 ddl. In conclusion, the surgical trauma caused the reduction of serum albumin in 0.58 ddl on average after spine surgery, but this study wasn't able to relate this reduction to complications in the post-operative period. Thank you.
Any question on last study? Yes, please.
Hi, Kurt here from Germany. Did you compare different procedures? Did I get it right? So I think it's very difficult to compare different procedures because the trauma during the surgery is different. So it's very difficult to get a conclusion out of that.
Yes. Thanks for the question. I analyzed different procedures, but the main procedure that we analyzed was the simple discectomy in 50.5% of the sample. But we analyzed all kinds of surgeries in a period of 6 months. Então, we analyzed all sections of spine, cervical, thoracic, and lumbar spine, and other procedures like deformities and fractures, all kinds of procedures of spine.
I was a little surprised by the high rate of low albumin before surgery. You know, it was 38% or something like that, wasn't it?
Yes, 38% before the surgery.
Yeah, but how would you explain that? I mean, you know, that's more than a third of the population who's going to operate in your hospital. It has got low albumin.
It's a public hospital in Brazil, and the nutritional assessment of these patients is very.
Okay. So did you do any substitution of the albumin afterwards?
No, the human albumin is by far the most expensive option for replacement. So we have to do new studies to relate the replacement of albumin with the low complication post-operative fields.
Okay, thank you very much. Any other questions? So then, thanks again for presentation and discussion. So, to summarize the session, I'm very thankful to all speakers.